Assisting in Pulmonary Medicine, Part 1 lecture. The following are the things that we will be covering in this PowerPoint presentation. Functions of the respiratory system. The respiratory system exchanges oxygen from the atmosphere for carbon dioxide waste and maintains an acid-base balance in the body. Respiratory acidosis is usually caused by hypoventilation and is due to an increase in levels in carbon dioxide in the patient's body. Respiratory alkalosis is usually from hyperventilation and usually is caused by a decrease in the carbon dioxide levels in the patient's body. Respiratory alkalosis is generally caused by severe anxiety attacks or asthma attacks. These levels are often taken from an ABG, which determines the hemostatic pH of a person's serum levels. The respiratory system. Here we have an anterior view of the respiratory system and a posterior view. It is important to note that everyone has 12 sets of ribs, and the job of the ribs is to protect the thoracic cage. Requirements for normal respiration: an open airway leading to the lungs, the ability of the lungs to expand rhythmically, intact alveoli membranes, coordination of an intercostal muscles of the diaphragm, and proper action of the central nervous system's respiratory control center. Our respiratory control center is the medulla oblongata. It is important to note that intact alveolar membranes are very important. Generally, patients with emphysema do not have these. And it is also important to have open airways leading to the lungs. In a case of emergency, and there are several emergencies present, the person that has an occluded airway would be the first one to be treated. Atomic structures of the respiratory system. On this slide, it is important to note that our upper respiratory tract consists of our nose, pharynx, and larynx, and our lower respiratory tract consists of our trachea, bronchial tree, and the lungs. Our bronchial tree is pictured here. You can see the right bronchus and the left bronchus. Also here you can see that there is a cardiac notch in our left lung. So our left lung is much narrow and has less air capacity. The lobes of the lung. The right lung has 3 lobes and is significantly larger than our left lung. Our left lung has 2 lobes. Our lungs have 2 membranes. It has the pleural membrane and the visceral membrane. There is pleural fluid that allows movement between the 2 membranes. Ventilation is regulated by the medulla oblongata. Bronchioles deposit oxygenated air into the alveoli. Surrounding capillaries fill with waste air, exchange with the oxygen that is rich in air in the alveoli. This gaseous exchange is ventilation. Inspiration is taking air from the atmosphere into the alveoli. Movement of waste gases from alveoli into the atmosphere is called expiration. Some abnormal lung sounds that you may hear based on ventilation off of inspiration and expiration are rales, rhonchi, and stertorous. Alveoli. This is a picture of our alveoli, which are at the ends of our bronchioles. The job of our alveoli is that oxygen carbon dioxide exchange. That's where this happens. In patients with emphysema, these alveoli lose their elasticity and the walls eventually stretch and then they break. And once a patient has enough of these that are broken, and once they do break, the oxygen-carbon dioxide exchange can no longer occur. So once a patient has numerous breakage of the alveoli, that's when they become severely short of breath and have major issues and are a little bit further along in their disease of emphysema. Emphysema is irreversible in these patients. Once they become further along in their prognosis, will need to be on oxygen and will be oxygen dependent. Respiratory defense systems. Upper respiratory tract has mucus-covered ciliated surfaces of membranes to trap particles. Then we sneeze it out or swallow it. Typically we think of our nares and our nose. Lower respiratory tract is sterile. The ever-changing airflow creates a turbulence inhospitable for invading substances. Coughing, sneezing, and immune system protection helps our respiratory system prevent those infectious organisms from living. Infectious diseases. About 75% of infections are in the respiratory tract, which seems quite high, but only 5% involve the lungs. So the other 70% usually are in our upper respiratory tract, a sore throat, or a sinus infection, or rhinitis. Those sorts of things are all considered infectious diseases within the respiratory tract. Diseases of the nose are more common. Most lung infections are seen in hospitalized patients, the elderly, substance abusers, alcoholics, and patients with AIDS or HIV. The common cold is a viral inflammatory process affecting mucous membrane linings. The nose, pharynx, larynx, and bronchus can be followed by bacterial infections of the pharynx, sinuses, and middle ear. Nasal congestion or rhinorrhea, sneezing, watery eyes, pharyngitis, also called a sore throat, laryngitis is hoarseness, and coughing. Rest and drinking fluids usually runs its course in about 3 to 5 days. The common cold is usually a viral infection, so we cannot treat it with antibiotics. If it is a bacterial infection, which typically we don't call common colds a bacterial infection, it would be treated with antibiotics, but this is rare. Sinusitis. Each sinus has an opening into the nose for a free exchange of air and is lined with a continuous mucous membrane. Infection or allergic reaction can cause one or more of the sinuses to become inflamed. Inflammation causes edema and collection of mucus with sinus activity, creating a feeling of pressure, nasal congestion, rhinorrhea, and classic sinus headaches. Treatment is usually decongestants, antibiotics if bacterial, and analgesics, and sometimes these symptoms can last up to 2 to 8 weeks. Allergic rhinitis, also called hay fever commonly. Allergic rhinitis frequently is confused with infectious disease. It's caused by a reaction of the nasal mucosa to an environmental allergen. Signs and symptoms include sneezing, nasal congestion, nasal itching, and rhinorrhea. Some of the ways that we can tell that it's an allergic rhinitis versus the common cold is itchiness in the throat, eyes, wateriness in the eyes are generally signifiers that it is allergic rhinitis versus the common cold. Types of pneumonia. So pneumonia is a general term for inflammation of all parts of the lung. Pneumonia often is seen in small children or older adults and is caused by a bacteria, virus, or other pathogens. Some of the signs are pulmonary densities seen on an X-ray, positive QFTs or quantiferum gold tests, and rales and rhonchi heard on auscultation. Tuberculosis. Tuberculosis, or TB, causes more deaths than any other infectious agent in the world. Vaccine does not always provide protection from the disease and can cause a positive mantle tuberculin test in the future. Tuberculosis is caused by the bacterium Mycobacterium tuberculosis and is spread by droplets of sputum and can be highly contagious if it's a primary infection. Primary infections occur and lungs become inflamed when tubercles are reactivated. Secondary or active TB can develop. TB can develop spores which allow to live an extended period of time outside of a living organism. And active TB is treated with long-term drug regimen and is to eradicate the bacilli. Usually there's dual or triple antibiotic treatment that is required because some of the bacilli have become resistant. A TB patient will have a positive PPD test. A positive PPD test doesn't always mean that the infection is active. A patient with a positive PPD test would need a chest X-ray to confirm whether it's active or latent. And if it is latent, the patient will only need to have a follow-up X-ray every 4 to 5 years, depending on the healthcare facility and the requirements when working with patients and people.